Hi, welcome to our telehealth medicine information video. I'm Garvin, and this video is on Hypovase. So Hypovase tablets contain the active ingredient Prazosin, which is a type of a medicine called an alpha blocker. It works by blocking alpha receptors in certain areas of the body. So what is Hypovase used for? It's used for high blood pressure or hypertension, heart failure, and a condition called Raynaud's disease, in which the arteries to supplying blood to the hands and feet go into spasm, causing pale, cold, and painful fingers and toes. It's also used for enlarged prostate gland or benign prostatic hyperplasia. So how does Hypovase work? Alpha receptors are found on the muscle in the walls of blood vessels. When Prazosin blocks these receptors, it causes the muscle in the blood vessel to relax and the blood vessel to widen. This lets the blood pass more easily through the blood vessels and hence reduce the pressure in the blood vessels. Prazosin can therefore be used to treat high blood pressure. Widening the blood vessels also decreases the effort required by the heart to pump blood around the body. Because there is less resistance for the heart to pump against, Prazosin can therefore also help treat heart failure, where the pumping action of the heart has become less effective. Prazosin is also used to treat Raynaud's disease and Raynaud's phenomenon, which are conditions where the arteries supplying blood to the hands and feet go into spasm and narrow. This restricts the blood supply to the fingers and toes and causes them to go pale, cold, and can become painful. Prazosin widens the blood vessels and so increases the blood flow to the hands and feet, thus relieving symptoms. Alpha receptors are also found on the muscle in the prostate gland. The gland is found only in men and lies at the top of the tube connecting the bladder to the urethra. The prostate gland often enlarges with advancing age, so pressing on the urethra and obstructing the flow of urine from the bladder. This can cause various urinary symptoms such as difficulty passing urine. By blocking the alpha receptors in the prostate, Prazosin causes the muscle to relax. This allows urine to flow freely past the prostate gland and relieves the urinary symptoms of this condition. So some important information about Prazosin. The first dose of this medicine may cause dizziness, lightheadedness or fainting. For this reason, you should take the first dose just before going to bed at night. Take care when moving from lying down to sitting or standing, particularly if you wake up in the night, until you know how this medicine affects you. If you feel dizzy or lightheaded at any time during treatment, sit down until the symptoms pass. Prazosin should be used with caution in elderly people, people with decreased kidney function and decreased liver function. Also used with caution in people taking blood pressure lowering medication. And Prazosin should not be used if you have an allergy to related medicines such as quinolones or doxazosin, Prazosin, and this medicine is not recommended for people who have ever fainted after passing urine or micturition syncope, or who suffer from drops in blood pressure that cause dizziness when moving from a lying down or sitting position to sitting or standing, or that's postural hypertension. This medicine is not recommended for people who have heart failure due to a mechanical obstruction of the heart, such as heart valve disease or blood clot in the lung, which is a pulmonary embolism. And Hypovase is not recommended for children under 12 years of age. Also, Hypovase should not be used if you're allergic to one or any of its ingredients. So you need to tell your doctor or pharmacist if you have previously experienced such an allergy. So regarding Hypovase and pregnancy and breastfeeding, this medicine should be used with caution during pregnancy and only if the potential benefit outweighs any potential risk to the developing baby. This medicine may pass into breast milk in small amounts. It should only be used during breastfeeding if the benefit to the mother outweighs any potential risk to the nursing infant. So you discuss these with your doctor. And for label warnings, so an important warning on the medicine. So this medicine may cause drowsiness. So if affected, you do not drive or operate any machinery until you know how this medicine affects you. So the side effects of Hypovase would be dizziness, drowsiness, headache, feeling faint or fainting, blurred vision, balance problems involving the inner ear, or which is vertigo, awareness of your heartbeat or palpitations, and shortness of breath, nasal congestion and disturbance of the gut, such as diarrhea, constipation, nausea, vomiting, or abdominal pain, and excessive fluid retention in the body tissues, resulting in swelling or oedema, an increased need to pass urine, feeling weak, depression, skin reactions such as rash, sweating, or itching, and a drop in blood pressure that occurs when going from a lying down to sitting or standing position, which results in dizziness and lightheaded, which is postural hypertension. Also side effects would be chest pain, increased heart rate and impotence, and persistent painful erection, which is priapism. The side effects listed above, or which I've just mentioned, may not include all the side effects reported by the medicine's manufacturer. So for more information about any other risks associated with the medicine or side effects, you need to read the patient information leaflet that comes with the medicine, or speak to your doctor or pharmacist for more. So how can this medicine affect other medicines that you might be taking? So if Prazosin is taken with other medicines that reduce blood pressure, either as a treatment for high blood pressure, so the antihypertensive medicines, or as a side effect, there may be an enhanced blood pressure lowering effect. This might make some people feel dizzy, particularly when you first start taking the Prazosin. If you do feel dizzy, you should lie down until the symptoms pass. If any dizziness persists, you should let your doctor know, as your medicine doses may need adjusting. Other medicines that can reduce blood pressure include the following. So the ACE inhibitors, which would be enalapril or captopril, other alpha blockers, so alfuzosin and doxazosin. So that brings this video to an end. If you have any questions, you can leave them in the comments below, or contact us through our website mytelehealth.info, or call to Lynch's Pharmacy, Douglas, Cork. You can ring 436-6923 to find out more. Thank you for watching. Stay healthy and stay informed.